Welcome back to the conversation. Today we have Dr. Kent Holtorf. Hi, Kent.
Hello, how are you?
I'm
Good to
so
be
good.
on again.
I know you're so fun to have on summits. You were with me last time on the Mitochondria Summit. I'm excited to have you back. Now, you're quite an extraordinary man. So for those of you viewing right now,
Usually they say eccentric and
well, you are eccentric. It's true.
right.
The first time I met you, it was like the mad scientist and the fun guy all wrapped up into one. It was pretty fun.
Where was that?
We were at dinner after a medical conference. We were at A4M. Yep.
That's when my staff calls me. I'm always mixing stuff and
Yeah.
trying stuff. I almost like kill myself every couple months because I try to find the toxic level of stuff and like peptides, which is very hard to do. And or just do crazy stuff and it's like I can't breathe. That's okay, don't worry.
You just use your own body as your lab.
Yeah, because I don't want to give it to someone till I do it, even though the studies are all there.
Oh my
But and
gosh.
then mixing creams all together, yeah, like the bathroom's just full of different peptides and creams and all this stuff.
I love it. I love it. This is what makes you so fun. So let's introduce you to our audience. I mean, obviously you can tell that he's got a great personality and you're going to enjoy this talk very much. But also on the serious side, you're the director of the Holtorf Medical Group and you have 22 centers and 9 franchises. You're the founder and medical director of the nonprofit National Academy of Hypothyroidism. You're also the founder of Integrative Peptides, which are peptide supplements that are available without a prescription. You've lectured at almost 100 CME approved medical society conferences and summits. And that's how we met at one of those conferences. And you're just an all around extraordinary human. So we're going to talk peptides today. We're going to talk about mitochondria and the importance of using peptides and helping restore mitochondria energy function. And we're just going to go down and talk about whatever comes to mind. We'll see where we go with this. Okay.
Sounds good to me.
Okay, so let's start off.
Let me just mention something we're doing. We started treating special forces vets for free and just doing all these tests on them. And our first patient, basically, he had been terrible PTSD. They all have traumatic brain injury. They all have PTSD. He had allodynia, where you couldn't touch his skin. It was like so much pain. He couldn't read a book, and they just kept blowing him off. He had a neurologist outside the VA. Then they found him face down, almost pulseless, liver failure, kidney failure. They put him in an induced coma, and they said he's probably going to die. But he made it through, and went to the neurologist. Nothing happened, and I don't know how he got hooked up with us, but within 2 visits, allodynia was gone the first visit. He could totally, his cognitive functions, PTSD, he could read a book from cover to cover. He then went hiking a few weeks later, and then a director somehow got heard about it and says, we want to do a documentary on this. And long story short, they got funding, so they approved a 12-part documentary on these vets. It's going to be on like Amazon Prime, Hulu, Netflix. And
Wow.
to show like just the care they get is terrible.
Yeah.
And and they all have, every single person has come up with chronic Lyme and multiple chronic infections, terrible toxicity. And we were talking about that, like everyone's just so toxic, and all these things suppress mitochondrial function. And even stress, stress is a killer. And you combine stress, chronic infection, and toxins. That's the 3 things that just make everything worse.
Toxic soup.
Everything's a vicious cycle.
It is. So that would be my first question is, how common is mitochondrial dysfunction and the causes of it? You've already outlined a couple of the causes here, but how commonly are we seeing this?
It's everyone. So, even just age, if you look at the graph of mitochondrial function, it just drops with age. Then you add anything, stress, toxins, so many medications are toxic to mitochondria. And there's no great test. But what we'll do is we'll check everyone's basal metabolic rate, which is mitochondria, how good your mitochondria are burning calories, making energy. It measures your oxygen output for 10 minutes and then extrapolates it for 24 hours. And everyone who's sick or people that have dieted, more than 3 times, studies show this too, they're usually about 25% lower than a healthy person, but it's hard to find a healthy person anymore because of all the toxins and that. So they have to basically, tend to gain weight, especially as we get older or if we're, sick. And so they have to eat 500 calories less just to stay even. So then they're starving again, lowers the thyroid level, which doesn't come back, even if you start eating normally, messes up the mitochondria. So we're just getting sicker and sicker. And then
We
with the
are.
mitochondrial dysfunction, it just causes so many problems because every cell needs energy. So you think of any system that needs energy, which is every system, especially brain, immune system, gut, those are particularly affected. So, we see these core conditions that are, just exploding, like, and then they give them syndromes like chronic fatigue syndrome, fibromyalgia, which allows them, unfortunately, to just basically ignore the underlying cause and just say, oh, you got chronic fatigue syndrome, here's an antidepressant, instead of looking at the underlying cause.
Right.
Chronic infections, chronic Lyme.
And we know the underlying cause of chronic fatigue and fibromyalgia and, long haul COVID. We know these things are mitochondrial dysfunction. We also know that, I always say that, end stage mitochondrial dysfunction has a word. We call it cancer. We call it heart disease. We call it Parkinson's. We call it Alzheimer's. I mean, this is the result of mitochondrial dysfunction. What would you add there?
Yeah. So basically everything's a vicious cycle in medicine. And when you get, especially that triad, toxins, and then if you have a chronic infection, but really immune dysfunction, and then if you have a stressful event, especially emotional stress, it modulates that immune system. People think, well, it lowers your immune system, but it doesn't, it modulates it. So if you think of the immune system, it's very complex, it's oversimplification, but if you think of it as Th1 gets stuff inside the cell, Th2 gets stuff outside the cell. Usually they're balanced. But as the thymus involutes, as you get older, if you have stress, toxins, chronic infections, autoimmunity, all these things, it starts shifting like this. So your Th1, which fights intracellular infections, you can't fight those. So then you get reactivating infections like Epstein-Barr, HHV6, HPV, and vaccines make that worse. And that's why people are getting like melanomas that spread like crazy. And then the Th2 is all this inflammation. So the body's trying to make up for the lack of Th1, and it's just causing all this reactive oxygen species. And then so you get hypothalamic, pineal hypothalamic pituitary hormone dysfunction, which then makes the mitochondrial function worse. And then with the low mitochondrial function, the immune system doesn't work as well, so that makes it worse. And so everything's a vicious cycle. So you start getting, chronic fatigue syndrome, fibromyalgia, cancer, really neurodegenerative diseases. They're all associated with autoimmune. And all these things. And you look at, we did a little, I don't know if I want to talk too much about vaccines, but one study on chronic fatigue syndrome, they did biopsies and did mitochondrial analysis. They found no chronic fatigue syndrome person had even a single person in the normal range for mitochondrial function. And they had a big panel that we can't do clinically. They can do it in a research mode, but no one was in the normal range. They were all completely outside the normal range, not just a trend to be low.
That is significant when we're looking at what is the solution to chronic fatigue syndrome and fibromyalgia. Mitochondria dysfunction is at the crux of it, is what I'm hearing you say.
Yeah. And everything, I say, well, what's the cause? But when you have all these dysfunction, like immune activation of coagulation, you can't detoxify, with the immune dysfunction, with low Th1, you can't detoxify. You're reactivating infections from the low immune system. You can't repair. You can't stem cell. You get stem cell exhaustion and what they call T cell exhaustion and immunosenescence, where the mitochondria will go into, let's say, a cell danger response from the physiologic stress. Or if you have a infection that doesn't go away, or cancer, or something that's stimulating the immune system, the mitochondria say, hey, we got it. Instead of make energy, we're going to start trying to fight this. And instead of making energy, they start making reactive oxygen species and inflammation. And then they're called, so that's, you'll get T cell exhaustion, but then you'll get immunosenescence. Immunosenescence is kind of permanent. So, but if you get, so it's basically the cells aren't working, but it's worse because they're actually making everything worse, and they'll recruit more senescent cells because they're pumping out all this inflammation. And so there's some things that you can do, peptides and other things to selectively get rid of those senescent cells, and mitochondrial function goes way up.
Right. What I really want to focus on for the remainder of this talk is peptides. You are a peptide expert. You have your integrative peptides company. I've used your peptides. I've used your peptides in my own protocols and with my clients. And I really want to make it easy for people to understand today, the people who are consumers of healthcare who are watching this, the practitioners who we have here watching this, who are wondering, how can I use peptides to get people better? Are you game to unpack all that for us?
Yeah.
Okay, cool.
Great.
So at the basic level, what is a peptide?
So, what is a peptide? So peptide's a chain of amino acids. If it's shorter than 40 amino acids, it's a peptide. If it's longer, it's a protein. That's just arbitrary. They're generally act on the cell surface. They say compare them to hormones, right? They act on the cell surface. They're quick on, quick off, very non-toxic. They, for instance, did a study on BPC 157 intravenously. They gave them 1,000 times the usual dose, and they could not find a toxic level. And that's the case with most peptides.
So that's why you double, triple, quadruple, 10x dose yourself at home.
Yeah, with BBC, most of it I couldn't get to a toxic level, but other meds I'll do the same thing, or some protocol. And they have what's called pleiotropic effects. And some of which the new thing is bioregulators, which I won't get too much into, but it's just, they're amazing. And they're just even dipeptides, so just even 2 amino acids, which no one paid attention, but they go into the cell and they open up the DNA and attach to a specific gene, so they work epigenetically. For instance, some will make it so it's like you've exercised. Some will great for, basically cognitive function, brain restoration. Other ones they tend to be, so they got them from the particular tissue. So they isolated them from, let's say, a calf liver or really a fetal liver, but now they're synthesized, so you don't have to have animal. But so they'll increase protein synthesis. They're epigenetic. They'll turn on, let's say 50 genes, they'll turn off some, and they tend to be they're kind of smart. They're kind of smart peptides in that they'll turn off all the cancer genes and turn on the anti-cancer genes. And tremendous studies showing reduction in cancer, increase in longevity. I think I mentioned before where they did there's going to be published a 2-year study on bioregulators and gave healthy people these longevity study, and they found in 2 years taking them, they checked their physiologic age, which we can do. There's telomeres and methylation of DNA, ways to do this. They were on average 7 years younger than the placebo group in 2 years. So
wow.
Yeah,
it sounds like that's going to be
going
to be an important up and coming topic and treatment modality.
Yeah, and so what I'm working on is formulating, adding bioregulators to the standard peptides, and so there'll probably be 5 or 6 types of BPC with combinations. You want a BPC for gut, You want one for brain, you want a TB4 frag for, this, that,
Yeah.
yeah.
So,
So it's
so
exciting.
so we've established that a peptide is amino acids. Amino acids are the small components of proteins. So I'm going to ask you a really silly question here, but I know people want to know. How does this differ from the amino acids that are essential that we have to take in from our food and the amino acids that our body makes? So why would I take a peptide in a supplement form when I get amino acids from the food I eat? So explain that.
Yeah. Well, your body, as you get older, all these levels drop, and especially with any chronic illness, stress. So your body, there's so many checks and balances and ways that are, get suppressed, that your body won't make these when, you just take amino acids. So it's kind of like giving precursors. You're just hoping it will make those, but those are going to go everywhere. So
Mhm.
this is much more specific.
Mhm.
And the nice thing is they don't get broken down in the gut like and they're typically from longer proteins that get cleaved at particular spots. So if you look at like all the common proteins, enzymes, they actually have, when they get broken down, there's sections that are left over that are these bioregulators.
Mhm.
And there's also a lot of bioregulators in food, like milk, although milk has some negative things, sea cucumber, whatever it may be. But they've kind of become where we thought kind of, the master controllers of hormones, but these are above that, and they'll modulate where hormones kind of do a thing, turn on, turn off. The peptides are kind of smart. Let's say you give BPC. If you have high blood pressure, you will lower it. If you have low blood pressure, we'll raise it. If you're hypercoagulable, which we see a lot of, it will lower it. If you can't clot and you have a bleeding disorder, it will raise the coagulation. So they're fine tuning and modulatory rather than just stimulating. And being what's called pleiotropic, they have a lot of different effects, and which actually ends up being much safer than a med that has a particular effect. It's more like supplements where they have a lot of effects, but they kind of modulate a bunch of things that end up balancing each other out, and they end up being much safer, but they're much more potent than supplements,
Okay.
in the thousandfold more potent.
Okay, so that makes sense why we'd want to use them. Now, can you focus in, and we understand what it is and why we'd want to take them. Can you focus in on which peptides are going to support A, mitochondrial function, and B, solving the problem of low energy? So how are we going to support energy with these things?
Yeah. So I'll put the mitochondrial peptides in a few different classes to make it make sense, I think. So the initial thing is immune modulation. So when you have immune dysfunction that we talked about, the feedback's going to cause mitochondrial dysfunction. So one of the first things you want to do is give immune modulatory peptides. So, and those, like, for instance, the most used peptide, and when I give lectures, and I have 100 studies on like BPC 157, and it fixes everything from people think it's a gut hormone, but for instance, this was a rat study, which you can do on attorneys too, but that
How about politicians? We do this on
yeah,
politicians.
okay, I'll take that.
Okay.
That's actually better. I like that one. And they had inflammatory bowel disease and also MS, and it worked for both, And the nice thing with BPC 157, it's equal potent if you don't have the salt. And there's a stable BPC, which is really unstable BPC. And this is getting too technical, but when they make it a salt, the body will actually, it's called acetylation and amidation. It will cap the ends of these peptides to protect them from the enzymes in the stomach. But company that came out with a salt, because the patent ran out on the acetylated, where ours are acetylated and amidated, which that's how it naturally is, and it decreases the polarity of it. So not only are they resistant to the enzymatic breakdown, they absorb better, They're much more potent. They basically have much higher affinity for the receptors. So it's much better, but they kind of named it stable, but it should say unstable BPC. But anyways, and that's where we tell people to start. If you're going to start with something, start with BPC. You can't go wrong. It works for kind of everything, whether you have autoimmunity, brain dysfunction, joint degeneration, neuropathy, stomach problems. Really, it promotes healing and reduces inflammation.
Mm-hmm. Okay.
And
then
then
give
if
us
you look
another
at
one.
the other, yeah, so if you look at the other, and we become kind of an immune modulatory clinic, we find when you fix someone's immune system, so many things get better. And if you want to look at basically, if you check someone's immune system and how we do that, we find a lot of people will do cytokine testing, but it can really throw you in a wrong direction, because let's say you have low Th1, like we talked about, which most sick people do, elderly, old age people, stress people, that the body will secrete these cytokines trying to raise Th1. But if you do that test, say, oh, you're Th1 dominant. No, you're the opposite. The body's trying to fix it. And oftentimes the cytokines, they work, you can test them in research, but they're very labile and they're very prone to just, degradation. So like a lot of times they come out and they're all zero, so that can lead you astray. But if you want to look at that Th1, what's the best marker for Th1 is natural killer cell activity, which is a particular cell that will monitor your body for cancer, for intracellular infections. It will also signal to other cells, hey, immune cells, let's get going. Now, for instance, with chronic fatigue syndrome patients, they found about 80% of those patients had low natural killer cell function, and about 25% had low natural killer cell number. So a lot of people have the natural killer cells there, but they're not doing anything. They're just exhausted, they're infected. And so that's a marker for Th1. It's a clinical marker. And the problem is that LabCorp doesn't do it, Quest does it, but you have to have special processing, and they screw it up probably half the time. So I'll try to do it multiple times. And we just actually talked to LabCorp to try to develop it, even though we asked them 10 years ago and they said they would, but they didn't. And then for the Th2 side, you want to look at C4A, which is it's a breakdown of complement. The one we're finding is human transforming growth factor beta. And this will go up with inflammation, but it causes so many problems. It causes immune activation of coagulation. It causes fibrosis. So you get, NASH, fatty liver, kidney disease, atherosclerosis, congestive heart failure. And bringing that down will all of a sudden, again, start fixing a lot of things, including improving mitochondrial function. And things that will actually directly suppress that, the human transforming growth factor beta, is a bioregulator called Vilon, TB4 frag. So thymosin beta 4. So all these thymic peptides. So as you age, your thymus here in your breastbone involutes. So it just starts basically shrinking. Starts about age 9 to 12, and it starts going down. And then it has its lowest point when you're around between 35 and 45. And if you notice, that's when you start getting all these diseases of aging. And so they have all these, like it was called a TRIM trial, where they gave like growth hormone and things to rejuvenate the thymus. But it's just give thymic peptides. Like thymosin alpha 1 is approved in 37 other countries for cancer, for chronic infections, totally safe. But a study came out in early COVID showing it was safe and effective for COVID. So the US banned it. Even
Wow.
though, There's
So if it
no
works, we get rid of it, right?
Yeah, because then they couldn't do the emergency, act with the vaccines. So what we did, we took thymosin alpha 1 and did what metabolomics, proteomics, and a number of other specific tests, and said, okay, what peptide is going to replace this that will have the same effect for a bunch of different biomarkers? And it turned out to be thymogen, which is about 100 times more potent than like thymulin, which is another thymic peptide, and Vilon, which is a bioregulator. And it outperformed thymosin alpha 1, and it's orally available. So thymogen alpha 1, with the combination, that it will lowers mast cells, it modulates the immune system, increase your ability to fight infections, or reduces autoimmunity. I mean, there's just so many things that these do. And then another one that will lower it is the KPV, which is probably the most anti-inflammatory substance I've seen. So like mast cell, and even on the mast cell mastermind group, and they're all stuck on, trying to suppress the mast cells. But the mast cells are normal. It's not an abnormal mast cell, it's upstream. It's what the heck is stimulating it. So you modulate the immune system, and so you stop stimulating those mast cells.
This is fascinating because this
KPV.
Hey, Ken, I just want to interject here because this whole mast cell problem, and this is huge. I mean, I can't tell you how many patients I talk to. They're like, I got mast cell. I'm not like, I can't do anything because of mast cell. And so what you're saying is there's a different strategy here to solving this.
Yeah, we don't even, we kind of say, okay, just hold on. They're usually on some mast cell inhibitors, antihistamines and Singulair. But if you fix the upstream and stop stimulating them, because it's this immune dysfunction, that it goes away. And also another big stimulator is if you look at these sick patients, they'll have low cortisol, but a high ACTH. Okay, there's a resistance. If they have a high ACTH, they have a high corticotropin releasing hormone produced in the hypothalamus, which is a very potent stimulator of mast cells. So if they have a high ACTH, you want to lower that, and a little cortisol works, but also fixing the immune system. I did a review article of HP axis dysfunction and chronic fatigue syndrome, and found that the overwhelming majority of patients with chronic fatigue syndrome and fibromyalgia had adrenal dysfunction, but it's not picked up by standard blood tests. And even, the ACTH stimulation test, which the endocrinologists will insist on, it's ridiculous. It's like hitting someone with the head in the head with a hammer and saying, "Oh, do you feel that? Oh, your pain's intact." So if you see someone with high ACTH, especially, and they have often low cortisol, then give a little cortisol. But then when you fix the immune system, you'll find that if you can reduce that CRH, but like people with POTS, interstitial cystitis, all these mast cell conditions, gut issues, when you fix these other things, that goes away. And it's a horrible illness, and they're just getting pounded on by the same stuff, antihistamines, and and they try 10 different types of antihistamines, and look upstream and fix the immune system.
So amazing. Well, Ken, I could talk to you all day on peptides. It's such a topic that fascinates me. I think what we've established here in this talk is that, peptides are a solution that people may not have thought about in terms of supporting mitochondrial health and supporting all other chronic inflammatory health problems. And so I would encourage our viewers to really explore peptides. Now you've got help available for practitioners, help available for consumers. Like I mentioned earlier, your products are available without a prescription. So can you tell us how practitioners can get support from you? I know you're launching a year-long training on peptides.
We should talk for a minute about mitochondrial peptides.
Yeah.
So we haven't even got to those. Yeah. So mitochondrial peptides stimulate mitochondria. And so there's basically two peptides that are made in the mitochondria, okay, that will stimulate. One is MOTC, and it's probably the easiest one to get, and it will directly stimulate mitochondrial function. And then the other one is humanin, which is been around. It tends to be expensive and hard to find. But the reason it was named humanin because they gave it to Alzheimer's patients and they became human again. Yeah. And so, I mean, these things they work so well. If you could, directly stimulate mast cells, mitochondria, you're going to make everything much better. Weight loss, immune function, autoimmunity, cognitive function, depression, again, all the neurodegenerative diseases, ALS. We have ALS patients coming in wheelchairs and they're jogging now. And they go back to the neurologist.
Now, are these the type of peptides people can get on their own, or is this a prescription peptide?
These will be injectable.
Injectable.
Because, they're too long to take orally. But and then there's also the other peptide, again, the immune modulator we talked about, BPC 157, thymosin alpha 1, which is hard to get, TB4 frag, KPV. Then there's you can get over the counter or just as a supplement like MitoQ, PQQ, CoQ10, but they're not that potent. There's this is a synthetic peptide called SS31, and it is 1,000 to 5,000 times more potent than like PQQ, CoQ10, because it selectively gets into the mitochondria. And so there's probably 15 studies on this in phase 2, phase 3. So it will be a drug at some point. And then there's one called 5-amino-1-MQ, which, physiologically, it tends to block this pathway of NAD. NAD will stimulate mitochondria, and it makes more NAD available to the mitochondria. So it stimulates them. And for instance, we had one of our doctors have her daughter, like, just, straight A college student and doing everything, but was so anxious, OCD, she kept pulling out all her eyebrows and was just having a tough time. And we put her on 5-amino-1-MQ, and within 4 days, she stopped. And then we gave her some other mitochondrial peptides, and then it stopped working. So then we gave her SS31. I think we over-oxidized her mitochondria. We stimulated them too much. So what SS31 does, it protects the mitochondria, and basically it works like an intracellular antioxidant. So it's really interesting. We see just incredible things like that. Other things like cerebrolysin, those are brain peptides, will improve mitochondrial function. Now T3, and I have the National Academy of Hypothyroidism, and I've done a number of review articles showing the way we diagnose and treat thyroid in this country is wrong. And people go by the TSH, which doesn't work unless you're super healthy, not exposed to any toxins, stress, you're not older, all those things. But that will directly stimulate mitochondria. Then the T2, which it will break down to, and is in some of the porcine thyroid, but they're trying to ban that, will actually will cause mitochondria to multiply. So those are a couple. Then delta sleep inducing peptide, which is used for sleep. It's not a sleep med, but what it does, it lowers the inflammation in the sleep center. And so all these people with like brain on fire, with brain inflammation, it lowers that, takes a couple of weeks to work, and it will actually, part of its action is increasing mitochondrial function. And a little pearl of someone has poor sleep. They don't get deep sleep, which is anyone with brain inflammation, traumatic brain injury, chronic infections, autoimmunity. And, all these vets also had antibodies to their brain like crazy. And so it's nuts. But you add delta sleep inducing peptide, epitalin, which is a pineal peptide, or pinealian, which is another one. And that will be the combination we have up next. But they're pineal peptides, but they actually will balance out your hormones. They actually increase telomerase, so increases telomeres, so you get younger. They had, studies, especially when you add it to a thymosin, like TB4 frag or thymosin alpha 1, and they give it to adults 65 years and older who had a significant heart disease. They had a placebo group. They followed them for 15 years. And the ones that basically got the treatment, only got 6 treatments too, over that time, six series of treatments. They had like a 2.5-fold less mortality, less morbidity. Their cardiovascular function increased while the other placebo group decreased. So these are kind of the, if you're going to take, one thing, it just, reduces your physiologic age. And they gave another one to rats that were menopausal, and they gave an epitalin to them. 80% started menstruating again, 25% had normal live births, so super anti-aging. And we'll use it for fertility along with kisspeptin and some other things, but NT3.
So I see why you're building a year-long program on this.
Yeah.
There's a lot of information. So Kent, this is incredible. I know that you've given our viewers hope, the ones who are watching, trying to solve their energy problems and chronic inflammatory conditions and diseases. I know you've piqued the interest of practitioners who want to know more about how to utilize peptides. I also am really happy to hear that people can go get intravenous peptides to help with some of these more advanced inflammatory diseases.
Yeah, and intravenous or sub-Q.
Yeah.
And then we have a cheat sheet that will tell you what they all do.
Mhm.
And also, if you're going to start, here's a protocol, like start with BPC.
So
this one.
Where can our viewers get in touch with you? How can they find you?
I would say email the site.
Go to, what's the site?
Integrativepeptides.com.
Great. And there's a place where they can go in and email from there to get more information.
And then we'll be doing the training program, and we're going to have a health coach training program too.
Fantastic.
mybettermedicine.com. So it's the peptide and stuff that works mastermind. But
peptides and stuff that works. Peptides and stuff that works.
Yeah, because there's stuff you gotta, they're synergistic with just about every med, another peptide. Like we'll start people on 10 peptides.
I know I've sent you messages before, like, hey, Kent, is it okay if I combine this? Can I use this and this? And every time you come back, yeah, do it.
Yeah. They can't find a negative interaction. It will actually, you look at the studies on BPC, it will prevent side effects of medications. Wow. For instance, if you overdose someone on amphetamines, you give them BPC, they don't have the symptoms. Or withdrawal, prevents a hangover too.
Yeah.
But so all these things, and also protects you against mycotoxins, EMFs. So it normalizes. EMFs will basically open up the calcium channels. People get palpitations and
which peptide is it? Which peptide?
BPC 157.
Oh, here we go back to BPC 157 is the one you've been talking about. So just take it every day.
Yeah, and also the TB4 frag and the Vialon, and they all do it with a different mechanism. So, and that's the thing, you can't go wrong with them.
Yeah.
It's just, it's the subtlety of using, what first. And
thank you so much for your information today and for your support of this project. And we'll make sure that everybody knows how to get a hold of you. And I'm gonna encourage everyone who just listened to this to go learn more about peptides from Kent.
Great. Thank you so much. You're doing a great job again, getting the word out on mitochondria. People go, what the heck is that?
Yes. And what the heck are
so
peptides?
important.
What the heck are mitochondria? All of it.
Yeah.
It's important stuff.
That's why we're here. Yeah.
It is. Thanks so much, Kent. You have a good one. Bye.
Great. Thank you. Bye-bye.